Assalamu alaikum. Welcome to our online session. I am Dr. Nafisa Rashid, Associate Professor and Head, Department of Pharmacology, Bashundhara Ad-din Medical College. Our today's topic is Routes of Drug Administration. It is a fundamental knowledge of pharmacology because when we decide to give a drug to a patient, we have to know the actual route of it. Whether it can be local, it can be intravenous, it can be oral, it can be intramuscular. The main thing is the most common route of drug administration is oral and most emergency route is intravenous. Now, what are the factors for choosing the route of drug administration? The guidelines for selecting the routes of drug administration are as follows, like some are drug factor and some are patient's factor. Now, what are the drug factors? Drug factors means the physiochemical properties of drugs, such as what is the consistency of the drug, what is the solubility of the drug, whether the pH of the drug is acidic or alkaline, or whether it can be irritative or foul smelling drug. Consistency, it may be very hard or liquid or gaseous, and other factors are foul smelling drug, chemical natures of drug, dosage formulation, and gastric acid stability, because we know that some drugs are not stable in presence of gastric acid, and dosage formulation means there are different type of formulation of the drug such as solid, liquid, gaseous, semi-solid, etc. Now, these are the factors regarding to drug, and there are some other factors regarding to patient, like hepatic fast pass metabolism. This is an important factor, and I will discuss it in our next slide. Site of injury. We have to remember that in case of injury, which route we should choose, or which will be the choice of our route, such as there may be local route may be sufficient, or in case of emergency it will not be sufficient. In that case we will choose the intravenous route or intramuscular route or parectal route, any type of route. Condition of the patient is very important. The patient may be unconscious, may be conscious, patient may be infant or old or adult, and patient may have severe vomiting or diarrhea. So, these factors we have to remember before giving the drug to any patient. And there may be severity of the injury. In acute case, the route will be in acute case, and the chronic case the route will be different. And desired duration of action, we want to if we want to get the better action, we have to memorize or remember the desired duration of action of a drug, and also we have to know about the adverse reaction of the drug. Now, fast pass metabolism. This is an important factor regarding to the patient. What is the definition of this fast pass metabolism? That means metabolism of the drug in the liver or gut mucosa before entering into the systemic circulation. That means we know that after absorption, a drug goes to the systemic circulation by crossing the biological membrane. So, before entering the systemic circulation, if the drug is broken down by liver or gut mucosa, then the action of the drug will be shortened or declined or deteriorated action. So, we have to make sure that it should not be metabolized before entering into the systemic circulation. The factors of fast pass metabolisms are route of administration, hepatic circulation, hepatic disease, and hepatic enzyme activity. Now, the most important slide of these topics is types of route. What are the types of route? It is an important written question also, and also important for Viva. There are two types of route. One is local and another is systemic. And systemic route can be divided into enteral and parenteral. Enteral, parenteral, inhalational, and transdermal. There are 4 types of systemic route. Enteral means oral, sublingual, and rectal. Oral, sublingual, and rectal. Oral means administration of the drug in the mouth, and it is swallowed with a glass of water. Sublingual means under the under the tongue where sublingual vein causes absorption of the drug, and rectal route means the administration of the drug in the rectal mucosa. Now, what are the parenteral route? These are the intravenous, intramuscular, intradermal, interarterial, intercardiac, intraperitoneal, interarticular, subcutaneous, etc. And inhalational route means administration of the drug through lungs, and transdermal means through some patches some drugs are administered into the body. Now, local route. Now, I will discuss about the routes of the drug administration. Local route. What are the advantage of local route? Local route means administration of the drug locally or the site of injury or the site of infection. Now, what are the advantage? The advantages are local desired effect, where the problem exists, the drug is administered only to that site. This is called the local effect, and it can bypass the fast pass metabolism, and there is no adverse effect or local adverse effect. But there are some disadvantage. What are they? There may be local irritation, there may be abnormal sensation and cumbersomeness, that is unwell feeling. Now, what are the formulation of the local route? That may be ointment, paste, cream, drops, powder, lotion, etc. Now, systemic route. The systemic routes, the drug goes to the site of action through circulation. I have already mentioned that there are 4 types of systemic route: enteral, parenteral, inhalational and transdermal. The enteral routes are oral route. Drug is swallowed with a glass of water and the drug goes to the stomach, and then the absorption occurs and goes to the blood. What are the advantages? This is the most safe route, most easiest route, cheap route and convenient route and painless also. No disturbance in the daily activity. Patient may take the drugs in his pocket and go to the office, school, college, etc. There will be no disturbance in his daily activity, and self-medication is possible. Ambulatory patient can take it. That means the patient who can walk, who can wanders around his activity, or he may go carrying the medicine in his bag. No need of maximum sterility. Hypersensitivity is less in case of this type of drug, and mental satisfaction of the patient. The patient is satisfied by taking the drugs in oral route. But there are some disadvantages, that is, it cannot be given in unconscious, non-cooperative patient, vomiting or diarrhea patient, because if we enter the drug and patient is continuous vomiting, then the drug will not be swallowed by the patient, it will be expelled out. In case of diarrhea patient, it cannot be optimum action. And in case of a non-cooperative patient will not eager to swallow the drug, or unconscious patient cannot be given in the oral route. And again, foul smelling irritant drug also cannot be given by this route. And emergency case, it is not suitable because it needs time to take the action, to onset the action of the drug. Drug may be destroyed by the gastric juice or hepatic fast pass metabolism, as I have mentioned before. Water soluble drugs cannot be given because water soluble drugs are not metabolized. We know that for absorption, the main factor of the drug is lipid solubility. And examples are like paracetamol, antacid, anthelmintic drug, etc. Now, sublingual routes, drug is absorbed by the lingual vein, and the advantages are rapid onset of action. In case of severe anginal pain, the nitroglycerin are given under the tongue by sublingual route, and there is rapid dramatic action. Within 1 or 2 minutes, the pain is relieved. So, patient is improved. So, rapid onset of action. Drugs can be spilled out after optimum action. In case of angina, if patient feel that there is throbbing headache, he may spill out the drug because it is not swallowed or not administered by IV. So, he can spill out the drug. Self medication is possible. It can bypass the fast pass metabolism, because this type of drug, if we give it by the oral route, they are destroyed by the gastric juice, and no gastric irritation. That's all for our today's lesson. Allah Hafiz.